presiding officer for this, the November 17th, 2016 General Body Meeting. Thank you all for being here this evening, and I hope that everyone had a great day at work today.
That's a question?
All right. Like I said, this is like our general body meeting, but it's going to double today for what we call our National Day of Empowerment. That is a nationally mandated program that all the YP chapters across the country have to involve themselves in, and this is our program for today. We're going to talk about the Our Dollars, Our Voice, empowered through Black Health and Black Wealth. Like I said, we just wanted to have this as an opportunity for you all to have a chance to see Black professionals in those particular areas, in the areas of wealth management and also in health. So, and we also wanted to choose like two young professionals that were someone that would have more of a, I guess, a view of what we all want to look for in our healthcare professionals and our financial professionals. We have like Miracle Reese, and we have Isaac Cooper. Okay, Miracle Reese. She's going to present like our Black Health Initiative. Miracle J. Reese has experience as a healthcare professional in hospitals and medical centers. She is a native of Tuscaloosa. She's completed her undergraduate and now graduate education at the University of Alabama at Birmingham. She's currently earning her Master's of Science in Nursing in the course area of Nursing and Healthcare Systems, Systems Administration. And will have completed her degree in this coming April 2017. She carries over 7 years of nursing experience from women's health, oncology, gynecology, emergency, neurology, and travel nursing. Her nursing career also includes working as a nursing leader and assistant nurse manager. Miracle's honors include UAB Quality Week Innovation First Place winner. She newly received the Sigma Theta Tau honors, and she's currently works at the Infection Prevention Coordinator for the Birmingham VA Medical Center. In her spare time, she truly enjoys traveling, volunteerism, and mentoring. She believes that our community needs a strong reminder of why health, happiness, and prosperity truly matters. I say Miracle Reese. Isaac Cooper, he's going to present our Black Wealth Initiative. Though he grew up in Fort Walton Beach, Florida, most of Isaac Cooper's family lives in London, but he originally derives from Jamaica, which gives him the unique global perspective on life. Isaac received a full athletic scholarship to Sanford as a cornerback on the football team. A 2012 graduate, Isaac is currently a founding and managing partner of IMC Financial Consulting, LLC. He is the founder of the Sanford Black Alumni Association, which is an official extension of the Sanford Alumni Association. So he's a board member of Growing Kings and the Sanford Overseers. He's the youngest in the school history. So you have like a very accomplished young professional here.
Yeah.
Not at all.
And also, I'm not just saying that he's also a newly appointed board member of the Birmingham Civil Rights Institute. So you're probably the youngest on the board, right?
Yeah.
Yeah, kind of. He's being bashful. But again, he's doing big things in Birmingham. Most recently, he's also named as the 2015 Agent of Change Award via AL.com and nominated for the Young Professional Year through the Birmingham Business Alliance in 2016. So, Isaac Cooper. So the way we're going to do this first is we're going to let ladies go first, and also because you have to be healthy before you can go and spend your money. So let's go the health initiative first. So what's going to happen, Miracle, she's going to have about 15-20 minutes to present her program, and we'll also take time for questions, and then after that, Isaac's going to have about 15-20 minutes to present his program, and we'll have time for questions. So first up, Ms. Miracle Reese. Woo! Thank you.
Good evening, everyone.
Good evening.
Thanks for allowing me to be here. I feel at home because I'm a part of Urban League. But anytime I can have a chance to speak on the issues or the topic of health, I'm always flattered and enthusiastic about it because that's the reason why we're here, depending on how our health is, right? So let me just start by saying that. When it was brought to my attention that Tanika addressed the issue of combating health issues among the Black American community, which is so very important, and I look at us as being one of those populations that fall among and we are just as important as any other group that's out there. Not to single anyone else out, but to realize that there's something great and special about all of you who are here. Let me start by saying I did hand out a small little take home, and that's just to keep you interactive, to help you think through this whole thing, and to address the key points that I was gonna start out talking about tonight. Well, I will give you my story to just hit home and to let you all see why health is such an important topic to me. I come from a family who we pretty much could have wrote that song that's out on Facebook right now, peas, greens, tomatoes, you know, the song that like we get excited about that in my family. We get excited about the momentum of food being a social aspect around everything. And the way I grew up was in a household that introduced me to all kinds of food choices throughout any time of the day when I wanted it. I had a grandmother who liked to give love through food, and I would take it, and she loved us a lot. It really hit home for me. In this year, earlier January 2016, I had a dream about PUSH Initiative, which is an acronym that stands for Progressing and Understanding Self-Help. And that initiative came about me just talking about it all the time, and my sister was like, why don't you do something about it? And the reason it was so heavy on my heart to take it from a thought to put into action is because I had an aunt that left this earth weighing over 900 pounds. And it did not have to be that way. It didn't. And I watched her throughout my entire lifetime contribute to her own health demise. It was a slow death. When I think about it, I say that, not to say that I'm insensitive to death, and not that I'm insensitive to those who don't understand health, but just because I have a better insight, because now I know what disease disparity looks like because I work in healthcare. As a nurse of over 7 years, when you're young, you don't have that focus of trying to make an impact or tell people how to live their lives. But what you can do is be an example. Going back to her story, she passed away in February 2013. Weighing over 900 pounds, and that day forward I made a conscious decision to say, you know, I'm going to continue on the road to getting the word out to my people about how we need to wake up, and we need to wake up now, because one thing you have to ask yourself every day is, how do I feel? How do I feel, and how do I choose to feel? And it's all about your mindset behind that. A lot of it can be credited towards or discredited towards your knowledge base that you don't have. Well, we have phones, we have internet that's easily accessible, you have many community outreach programs, you have this great organization that is trying to help you get outside of that shell that you're in, and to get more so in a conscious awareness of how we can do better and improve our health as a Black people. So that's my story, just to open up and give you insight. I don't know if you all have heard of Healthy People 2010, that big nationwide initiative. So that whole thing was centered around the whole population, the American population. But what I see is it continues to greatly fail in African Americans. And the reason I say that is because obviously our current president, Barack Obama, saw fit to put together, well, in other words, he saw fit to try to make healthcare accessible for all people. And guys, I don't know about you, but underlyingly to me that says all people means you are a big part of that. So the Affordable Care Act in 2010 that was signed by him was to give us accessibility to healthcare. But many of us do not take heed to that. We don't take heed to that. Which brings me to 5 points that I want to bring about. Really ask yourself, do you know your status? Do you know your health status? if I ask you, hey, how you doing? You say, oh, I'm good, I'm fine. But really, do you ask yourself, where is my health? How do I feel on a daily basis? How do I feel 365 days of the year? If I had to give a broader percentage, 90% of that time, how do I feel? Is your health poor? Is it fair? Is it good? Or is it great? To me, you decide how you feel as a healthy person on a day-to-day basis. Also, another need to know point is to know yourself. I think we all need to wake up and realize that you're the captain of your own ship. You know your body better than anyone does. Just because you are young, just because you are able-bodied now, I think it's so necessary to look into your future and realize that a part of the aging process does not mean that there has to be pain. I say this because I realize that also the reason we're touching on this subject is because we get our health together in order to save dollars in the long run. We get our health together to save dollars in the long run. The cost that it would take for you to pay for a medication prescription, or the cost that it would take for you to pay for a surgery that was not needed, where you could have prevented that. So pay close attention to yourself. Ask yourself these things. How am I sleeping at night? Am I getting enough rest? On average, all of us are pretty young. I think we're all ranging from between 20s to mid-30s, lower 40s. So on average, we should be getting about 7 hours of sleep at night. Do we get that on a normal basis? Probably not.
No.
But just to wake up and feel the vibe, you know, for some people can go off 6 hours. That might be your healthy area in which you get your rest and you're ready to come back today and go. But on average, about 6 hours a night. Ask yourself about your mental capacity. Are you able to concentrate? Are you able to focus at work? Are you able to stay awake at work? Do you have enough mental storage that you can remember things? That's another question to ask yourself. Also, let's think about health in the aspect of emotions. Do you feel happy a lot? Do you feel in between emotions? Do you feel sad? Do you come and go throughout the day? Do people make you angry quick? That's something to think about as well. And also, I always like to say that when I speak about health, I don't speak to just women, I speak to men as well. So with that comes attitude. Let's speak on the point of positivity. Do you have a positive outlook when it comes to knowing that you are the person that's responsible for you? Do you gain knowledge each and every day when you go out into the world and you go to your job? Do you log on the internet and look up articles that might be specific to your health population? That's one thing to ask yourself as well. A lot of times I know that men can be stubborn, but it's just as important that you go and check on yourself as well as women. And I know one thing that stands out the most would be for men to worry about prostate issues. I come from a background of women's health, so a lot of times, of course, I get a lot of female questions, and it's not a secret that women know how to take care of themselves a little bit more than men, but men also be aware that your prostate health is also important, okay? Another key point is to always eat colorful, out-of-packaged foods, and what I mean by that is, don't be so prone to grab something that's quick and easy to grab, to tear open at that desk when you're sitting there with nothing to do when there's a lull phase. But grab your fruits and vegetables, grab your things that are crunchy and incorporate more of those into your day-to-day. Another key is to drink and eat less sugar and salt. How many of you know that there is a heavy content of salt in cheese? The healthcare professionals.
All the people in the scrubs, they know.
Yeah. There is a hidden great amount of sodium, you know it as salt, just like Grandma said, in cheese. And I know we are cheese crazy in America. So just those little small things that you take about in a day. If you're gonna eat it one time today, don't eat it tomorrow. Skip a day and moderate. Think about it. What about sugar? Guys, I know you like Gatorade. You like Powerade, you like Gatorade. Well, guess what? Gatorade is loaded with sodium and sugar. I know it tastes really bitter and salty, but it's one of your high contents of sugar when it comes to beverages. People ask, well, what's a pretty good, decent amount of sodium to look for in your foods or in your drinks? And to me, usually if it's a food, less than 400 milligrams. If it's sugar, less than 20 grams of sugar, okay? And last but not least, keep it consistent when it comes to your health, and that has all to do with your blood pressure checks. To check them monthly, make sure that you are aware of your number. Who knows a healthy blood pressure number?
I was in the medical professionals.
Like 70 over 120.
No.
120 over 70.
120 over 80 is your average number that you hear. But that top number represents the workload that your heart is putting out. I mentioned blood pressure because among our community, blood pressure is one of the #1 things that we can prevent. That can prevent a doctor's visit easily. And you probably heard it being called the silent killer. It's because most people don't pay attention to it. But it's the elephant in the room that needs to be addressed. So blood pressure, let's talk about that for a second. That top number, that 120 number, that is when your heart is pushing out all the perfusion in your body, meaning blood, oxygen, nutrients that your body needs to get in order for you to stay upright and standing. Excuse me. That bottom number is when the heart relaxes. It's not squeezing anymore, but it's filling back up. It's capacitating the heart to be able to fill back up to push more blood back out that next time. So let's imagine your blood pressure is 190 over 100. What do you think your body's going through at that point? It's doing too much. It's stressing. It's putting too much pressure on those vessels, making your body overwork. So with that said, please make sure you are minding your blood pressure and getting it checked monthly, okay? Good ways to do that. People who don't like to go to the doctor, your local fire departments can do it as well. And then you have people who are here every month at these meetings. You'd be glad to check your blood pressure. Doing these things can absolutely save you money. These key factors on this sheet. With having good health, you can use fewer sick days. I know some of you want to use those sick days because you look at it as being a mental takeoff day, but you can use fewer sick days, have more time that you can save up when you absolutely need to use those days. Also, like I mentioned before, it saves the cost that you might use to have to take out expense for medication purchases. Excuse me. It also brings me back to look at the fact that obesity is a growing thing in our community that we all need to pay close attention to. I think our children are falling into this area as well. So with these key take-home points, please look and research a little bit more for yourselves. I hope I said something in a good way that can draw your attention to making sure that you are more health aware, okay? Push initiative began as an idea to start among my community and really to get my family moving. But I would like to invite you all on December 3rd at 8 a.m. Homewood Park to a body camp. And I call it body camp versus boot camp because boot camp can be intimidating. But it's really a 40-minute workout outdoors to get your heart pumping, take your mind off of the whole exercise word, and more so have fun and get you moving. I would like to close by saying, know your health. Know that health does equal wealth. And that when you open your mind to the possibilities of reaching your healthcare goals, the possibilities are endless. So thank you.
All right. At this part of the program, are there any questions for Miracle about Black health?
So I have a question. So Miracle, when you're talking about blood pressure, is that also dealing with hypertension? When you have high blood pressure, is that also the same as hypertension?
Yes, that is the same thing.
Yeah, I was thinking about that because I saw the episode of, y'all gonna laugh at me. I was watching Good Times recently. When James Evans was like, I got these headaches, and he was getting angry and stuff all the time. They're like, Dad, you need to go to the doctor. You maybe have hypertension and stuff like that, you know? And people don't realize that they angry and they got headaches all the time. They can't sleep, but they want aspirin. They may have hypertension.
Definitely. It's a silent piece that we usually don't pay attention to. And it's so easy to get so busy and wrapped up in your work week. But just like myself, I'm young, I feel great, but it's necessary for me to know those numbers on a monthly basis.
I guess I have a question too. Are there any like certain questions we should ask like our physicians when we go like for our yearly physical, like something that we just need to, I guess, ask them about ourselves that we to keep ourselves healthy?
Sure, blood pressure being one. When they take that, when they assess your pressure, don't just let them take it and say, oh, very good. You actually need to know that number. Your vital signs are your clinical indicators to what's going on in the inside of your body. That's one of the first pieces that you would use to assess a patient, as well as assessing the subjective information that the patient would give, meaning what you tell your doctor. Another important question may be to ask him, talk to him about your family history. I mentioned prostate when it comes to men. I will mention this: if you are in a family where you've had a father or a brother, a close sibling, someone older that's 65 years of age who's been diagnosed with prostate cancer, you just need to know that it's good to get screened at about the age of 45 if you're a male. Start out as early as that age in order to make sure you don't have those precursors that make you more vulnerable to getting the same disease, which is prostate cancer. For women, I think we're pretty good when it comes to questions anyway. I think whatever comes to mind usually comes out. It's always good to know about your medications when it comes to being a male and female. It's good to ask those necessary medication questions, which include what are the side effects of this medication, what things should I look for if I think that I need to come back and see you. A lot of times they can give you these side effects. Oh, they're just, those are just the things that people have reported when they've done the research. But you really need to know, does that medication cause hair loss? Is that medication going to make me drowsy? Is that medication going to take away from my libido, which is very important? Your sex drive is important if you're married or whatever your situation might be. I feel like that's absolutely a necessary part to know of your health when it comes to those physiological needs.
I know a lot of younger people, they may feel or say, I'm healthy, like I don't see a need to go and get a physical or something done. At what age would you recommend that we start monitoring those particular things that are prevalent, like family, passed down diabetes, hypertension, all of those standard, kind of like the trifecta of healthcare issues that we typically face as African Americans?
Good question. I think that if you know that your family history is more prevalent and is strong, and you know that mama, along with Big Mama and Big Mama's mama had, it is absolutely necessary for you to ask those questions now. The reason I say that is because with things such as, I'll throw this out there, I'll go back to prostate, there are early indicating tests that are there in place for you to see if you have those precursors or early markers that are part of your DNA that might have been contributed from your family history. With that said, that does not mean, oh my gosh, I should be getting ready for my deathbed now. That doesn't put a black cloud over you, but it's to make you more aware and to let you be more proactive in finding out the necessary steps you need to take in order to make sure the signs and symptoms later on that could come about, that you are staying ahead of that. When it comes to people who, diabetes is another one that I think a lot of African Americans deal with. If you know that runs in your family, your hemoglobin A1C right now, it doesn't cost anything if your doctor's going to draw a blood panel anyway to include that in there and make sure you are within that range. And for those who are in healthcare, know there's a healthy range in where you should stand versus somebody who is a little bit closer on that edge number that makes them more prone to having diabetes. Yes, ma'am.
I hope you don't mind if I step on your toes.
Not at all.
So every female that's in their 20s, you need to, and you haven't already, have a cervical exam, at least one, with a pap smear, period. Every female that's in your 30s, at some point you need to start talking to your doctor about when they want you to do a mammogram or a breast exam. That's more official. Everybody that's in this room, by virtue of you being African American and by virtue of you having at least somebody in your family that's got hypertension, cardiac disease, diabetes, you should be getting your lipid panel, your hemoglobin A1C, as she mentioned, and your, we call it a CMP, on a regular basis. So whether that's yearly or every couple of years based on what your doctor prefers, but you should have already at least had one of those done. Everybody in this room by now, because everybody's out of college, it looks like. So those are basic things that you should be at least knowing to go and ask for. And if your doctor is not providing you with those, or if you're not going to the doctor because you feel like you're healthy, you might get a big surprise when you discover that you are at risk and farther at risk for a lot of these things than you thought.
She's absolutely right. She's absolutely right. And I think a lot of times we're shy because we don't want to come off as not knowing the answer already, or we feel somewhat intimidated by not being a doctor who's of the same culture as ourselves. But that's where you become the responsible one. You look those things up before you even go. Now with the way that Tamara and I were talking about this performance-based care, when it comes to making sure your doctor is giving you the same fair treatment that he would give someone else of a different culture, you are responsible for pressing him to know the answers to those questions that you feel like you're not getting the right answers to. It doesn't come off in an attitude way, it just comes off as in a I need to know basis. So she's absolutely right. Those tests are things that you definitely should have on your, at minimum, list of things to ask your physician. Yes, ma'am.
You mentioned Obamacare and this new administration rolling in. What do you think is going to become the role of community organizations, the healthcare profession in general, in dealing with disadvantaged communities in terms of making policy? Because at some point it's probably not going to be enough just to have programming. We're going to really have to get involved in making the laws that determine people's access to medical care and protecting the laws that we already have.
I do think, of course, in America, we are one of the most sketchiest when it comes to healthcare. You go into other developed countries and they have this one layer, just to put in layman's terms, of healthcare that is even throughout, regardless of race, creed, whatever. There's one plan, it's not confusing, but we live here in America where we have all kind of different pieces that we have to pull from when it comes to our healthcare payment system, our healthcare organization systems, our layouts, our third-party payers. It's very confusing. So what do I think is going to happen with the change in administration? Of course, there might be, of course, you guys aren't asleep like me. I think there will be a great shift in what's going on right now. I think there will still be an access issue. I think that most things that people that are of minority culture seek health care for, they're really a lot of times social work issues. So those things are still going to be left unresolved. You have a lot of times, I'll use this example, someone who doesn't have access to a computer, so they didn't have access to go on and register for the marketplace, which is your insurance payment plan ran by the federal government to give you access to health care to be seen. They don't have access to do that. So the first thing they're going to do when they have a cough or a cold, or if they don't have anywhere to stay, would be to go to the emergency room. And what does that do? That makes the taxpayers, us, pay for their visits, which is necessary. They need to be seen as well. But the bigger issue is that they're homeless and they need somewhere to stay. And the bigger issue is that they didn't have access to register for that marketplace plan. So I still see it being shifty. It's still shifty now. People who didn't have insurance before, with the cap off of pre-existing conditions, that helped. But there's still going to be issues when it comes to Black people gaining the care that they need. I see it becoming worse. To be quite honest, that's just my personal opinion. So yeah.
I think that goes back to what you said maybe 3 statements ago. I am a physician, and so unfortunately, most of the studies I look at show that whatever the situation is, if it's appendicitis, everybody that looks this way is more likely to be treated X, everybody that looks this way is more likely to be treated Y. And so what that means for you, your family, your friends, regardless if they look like you or not, every time you go to that doctor, you really have to be your own advocate. And if something doesn't make sense to you, you have to speak up. I have a white relative who died because nobody thought to question the doctor about why this woman wasn't on dialysis. And nobody thought to ask me either, but side point. You have to be your own advocate. And yes, it's our job as healthcare professionals to be, your advocate and look out for you, but sometimes we just assume, okay, well she seems okay with what I said, she's not pressing me on anything, so I'm not gonna offer her these other 5 things. that I offer to this woman over here. You have to be your own advocate. And it doesn't come off as being rude unless you take it there. It comes off as you wanting to care about yourself and that you're putting in the time and the energy to do so.
And people move better when you do that. When you take the initiative to be, like you said, your own advocate and ask those questions and gain those answers, they look at you in a different respect. But if you sit there and you take whatever is being handed to you, you become inventory and people move on more so, or they move on to the next bigger issue or the next pressing issue. So she's right, absolutely.
One more question, we're good? Is everyone satisfied?
I got a question. I asked the last question, so I just entertain myself.
Of course, Mark.
Well, I like to keep it entertaining. I mean, this is gonna be easy. I mean, but one thing I hadn't heard is, I guess, what would you recommend as some simple things that people can do just to improve their overall health? Like, for instance, drinking water, or, you know, the conversation you and I had earlier about just taking supplements and vitamins and stuff like that. If you could just pick like one takeaway point, what would you think? What would you think if you could recommend to somebody else?
I would say move more. Don't be so lazy to sit in your office chair. Whenever you get downtime, walk the halls, be social. It always helps. And I will always say eat better. If you know that you're at a point right now, you're not going to just go cold turkey, at least try to do better. And what I mean by better is I made that point about eating outside of a package. Try to refrain from the packages so much. Shop outside the aisles. Produce section. There's so much convenient foods out there. You got carrot sticks in a pack with ranch dressing. You don't have to eat the ranch dressing, but you can eat the carrot sticks. Or you got the celery. You got apples already pre-cut. There's really no excuses to it. I realize that we all have a busy lifestyle. Some of us might even have children. But if you make a conscious decision to move more, about 10,000 steps more, if you don't already move about 10,000 steps a day, and eat better. And the eating better would also include, you're right, incorporating water intake versus drinking so many sodas or your artificial sweeteners.
And actually, I would like to add, it's more than just eating better. Eat plant-based. That is what's really going to help if you eat more plant-based foods. Because right now we work with individuals whose health is not the best, and it's their diet. You know, they have a largely meat-based diet, and you've seen the cows, you've seen the pigs. So if you're going to put that in you, you're going to look like the cows. You're gonna look like the pigs. So, you know, especially for us with diabetes, most of our biggest thing with type 2 diabetes is our cooking habits are passed down from grandma to mom to your current. And you're cooking with these, you know, lard or, you know, Crisco and all these other very unhealthy things that's just making your numbers go askew. So plant-based.
Thank you. I guess I'm a case in point. Like I said, I just want everyone to be, I guess, healthy, empowered. You know, just to be empowered with your health. Because I'm starting to take I guess, more of a greater interest in my own health. Plus, I'm starting to go to the doctor yearly for my annual physical, and I'm also found out that everything's good except for I need to lose some weight, and also that my hemoglobin levels are kind of on the edge, so I need to keep that under control. So definitely, if you have a chance to go and take your yearly physical, please do so. Since Miracle's gotten us on the path to a healthy lifestyle, let's go on to the path to a wealthy lifestyle with Isaac Cooper.
How y'all doing? Good. All right, so tonight's gonna be a little unorthodox. I'm gonna ask questions first, so I can frame this conversation. I don't want it to be a monologue. I want it to be a dialogue. So I want to ask questions first to get an understanding of what you guys wanted to expect whenever you hear Black wealth or wealth in general. And we already have a question in the back, so.
I'm ready. That's all. Your handout was on home buying. What percentage of your income should you have already paid just to go in and look for your home? Obviously depends on what kind of home you're looking for, but what percentages should you already have? And then how much of that should you take into account knowing that first year is going to be rough and there's going to be fix-it things and yada, yada, yada. So like, what do you really need to have going into getting, say, a one-family home? So like
Okay.
2 adults and 2 children.
Great question. Just for some quick clarification, this actually is not my handout,
Oh, I'm sorry.
but I am going to answer your question. It's a great question. Next question. So everybody here want to buy homes. Okay. Yes, ma'am.
So, for people that are employed full-time with benefits, what should you realistically be putting into all those lovely retirement packages? How many should you have? Should you look for someone to help you invest, or is it better for you to learn the system yourself? What are some pros and cons to each of those?
That was an A, B, C, and D question.
That's like 5 questions you got lined up already.
Great question. Great question.
Come on,
What
go.
else we got?
You taking questions now?
Yes, ma'am.
Keep on going.
Keep going.
Some of us are in a lot of debt from education.
Yes.
Do you have any special tricks other than I have to take a decade of my life to pay off these loans that we can look at to maybe get to that point quicker?
Okay. What else?
He said, what else?
Everybody was like, yeah, that's good. Did you have something?
Yes, I've heard that it's not always a good thing to let money just sit in savings. So what are other options to make your money grow instead of sitting in savings?
Mhm. Great question. There we go. Now we're rolling.
Oh yeah, and, could you touch on life insurance, the importance of, and the right type, and all that type of stuff?
Yes, sir. Yes, sir.
You touch on like stocks, bonds, mutual funds, all of that.
Yes, sir.
Can you talk about term life insurance versus whole life?
I sure can. Yes, ma'am.
Can you talk about best ways to pass on your wealth to generations? For instance, I tried to open a CD or something for my nephew, and I was told that that no longer exists or whatever. So best ways for you to go ahead and start putting seeds into the younger generations.
Right. They said CD doesn't exist.
They told me whatever I was asking for, they couldn't do. That I have to open a legit savings account for this little
Let
boy.
me know who that is.
Yeah, I was thinking the same thing. You might not want to say that on camera, but.
Thank you for reminding me. I was about to say something else on top of that.
But see, that's why I'm always conscious of what's going on.
Right. So these are all great questions. Before I dive into the questions, I'm gonna give you a quick synopsis of what got me in the industry, a quick synopsis of myself. You heard a good bit of my history just based off the gracious introduction. So again, from Fort Walton Beach, Florida, football is what brought me to Birmingham. Injuries pretty much put a halt on football, my football aspirations. Of course, wanted to go to the next level, you know, save the world, pay off everybody's debt, make all these millions of dollars. That did not happen. But naturally, while I was growing up, I've always been comfortable with numbers, right? Just that one guy that low-key enjoyed math but didn't tell anybody about it. So once I transitioned out of Sanford, I was actually very, very, very honored to be with the Fortune 100 company. I was with the #1 office in the country at the time. And I wanted to give you a quick narrative of a situation, and then I'm going to dive into a process. And I'm going to try my best to address every question, because each question that was asked, there's going to be more questions when I explain. And so if I don't capture everything, I'm going to make sure that you guys have my contact information. You can reach out to me on my cell, email. We can continue the dialogue. So the company that I was associated with, again, #1 office in the country. You know, I'm sitting next to guys that, you know, woke up and they were multimillionaires and they didn't even know it, right? We're talking about wealth transfer. I had a specific meeting with a gentleman, him and his soon-to-be wife. It was actually his fiance at the time, and I have a process that I go through. So I have 6 principles that I work off of. One, first principle is I want to identify what are your tax deductions, right? Where are you giving on a consistent basis? Are you tithing on a consistent basis? I don't get into the why behind it, but if you do it, that's something we need to address, right? Second thing, what are you doing to protect your assets and income, life insurance, disability insurance, things of that nature, emergency fund, plan to eliminate debt, 10+ year goals, just that whole shindig, right? So I'm having a dialogue with the husband, the male and his fiance, and It's 5 years ago, and I'm asking them, all right, what are your game plan? You graduated college 3 years ago. She's about to graduate college. Typically, folks that are in this space, they plan to eliminate debt. They want to buy a house, get a car. Where are you guys on this agenda? He said, Isaac, we actually got a couple of those things squared away. I said, fantastic. He said, we just bought a house about a month ago. I said, that's great. How much is it worth? He said, $250,000. I said, is it safe to say, since you bought it a month ago, that's what you owe? He was like, nah, I actually paid cash for it. Okay, write it down. I said, ma'am, I'm pretty sure that you're looking to get another car. You had the same car for a while. What are your guys' plans pertaining towards that? He said, yeah, we actually got that squared away about a month ago as well. We bought 2 vehicles. I said, fantastic. How much are the vehicles worth? He said, $50,000 each. Okay. Is it safe to say, since you bought it about a month ago, that's what you owe? No, we paid cash for it. So I said, okay. In my head, I'm like, that boy making some money. I don't know. But he was making some money, right?
He already $300,000 in.
Right.
I'm counting.
So get to the point where I asked about income. All right, how well do you see yourself doing, in regards to income this year? He sat back, folded his arms, took a deep breath. He said, man, you know what? It's actually going to be a pretty good year. So I'm licking my chops like, man, I want to see what this number going to be. He said, I'll make about $48,000. Drop my pen. I said, sir, if you don't mind me asking, where'd you get the cash allocated towards these assets? He started laughing. He said, man, I forgot to tell you that my grandparents left for me through a trust fund, through a life insurance policy, that once I graduate college, I get X, right? House paid off, 2 vehicles paid off, no student debt. He's making $48,000 a year, roughly about, let's say $2,900, $3,000 after tax. Expenses, normal monthly expenses are like $500 a month, right? He could save $1,500 a month. That's 18 grand a year. 26 years old. So whenever he looks for a job, he's finding something he's passionate about instead of looking for something to pay the bills. Now, that was the first time that I've ever met a recipient of wealth transfer. Hear it all the time. And I said, that's how y'all been doing it, right?
He's like, I got you.
Right. I wanted to walk out and be like, man, I'm going to tell all my homeboys. But with that being said, it drove the passion. The company that I was with, again, the office that I was at, I was the only black in the office. I was actually the only black in the state of Alabama. And so while hearing all this good information, the first thing that hit me wasn't, man, how come I'm the only black? Or I'm frustrated because there's nobody in here that looks like me. I got excited because in my head, the natural thought was, if I'm the only one hearing this, who's out here sharing it, right? And so I wanted to make sure that I was very, very intentional on sharing this type of process with our people. All right, now to your questions. I'm going to start line iteming some questions, but also identify a process as well. And I'm going to make a couple of statements before I dive in. One of the biggest misconceptions that I see about wealth is that you got to have money to make money, right? Biggest misconception. Isaac, man, I ain't making no money, man. I'm going to talk to you later. Okay. The difference that I see between those that are wealthy, and wealth could be defined in so many different ways. Typically, I don't use it in a monetarily space. But those that are wealthy and those that are not is typically, one thing. They've established a habit, right? 96% of the people in the country spend first, then save. I'm gonna knock these bills out. I was looking at these shoes a couple of weeks ago. I may get those. My friends just coming to go out. After that weekend, you see what's left. You say, all right, I'm gonna try to save what I can. 4% of the people in the country, they save first, then spend. Right? That 96% works for that 4% in some capacity. Well, Isaac, how so? Well, that 96%, since you are not being consistent with how much money you save on a monthly basis, when something happens, AC's gonna go out, you're gonna need tires on a car, things are gonna happen that's actually gonna be extreme, it's gonna be a big inconvenience to you, personally and also financially, in which Since you don't have enough money in your savings because you have not established a habit to save consistently, what do? Grab that credit card. The interest you're paying on that credit card, guess who got stock in it? Got 4%. So every time you pay interest, they get paid, right? So the one thing that I want everyone here to understand on the front end is that when it comes to wealth, when it comes to investing, when it comes to creating different vehicles to put dollars into, the first thing you have to do is save on a consistent basis. I've had at least, it's Thursday, I had at least 7 meetings this week in which guys say, Isaac, I want to invest $5 grand, I want to invest 10 grand, I want to invest 15 grand. And I said, man, you haven't even established a habit of saving first. You're not ready for it, premature. Other folks say, oh yeah, bring it on in, yeah. Nope, I want you to establish a habit. That's the first thing I want you guys to do. So I'll get off that Kanye rant. Let me get into some of these questions. Home buying, it's going to be the last thing that I touch on because I think some of these other points are extremely important. Employer benefits. So who in here works for a company and have benefits? Some benefits, 401k, things of that nature. Okay, great. If I asked everyone in here that has a 401k what your balance is, who would know it right off top? If I asked everyone in here what are you putting in regards of what you're putting in and what your company's matching, who would know that answer? Okay, if I asked you what is your year-to-date return, who would know that answer? Guys gotta know this. That's your money, man. That's your money. That is your money. And so a good bit of questions that I get surrounded around employer benefits, 401k, things of that nature is, Isaac, how much should I put in? Should I even put anything in? I literally had a conversation on my way here for about 20 minutes with a guy trying to tell me why it didn't make sense for him to put money in his 401k. And guess what his reason was? Man, I already did the paperwork, man. You telling me I got to do the paperwork over again? Yeah, buddy, that's free money. I tell folks this all the time. This is my rule of thumb. If they match 5%, put in 5%. It's free money. That is free money. Now, the allocation, things of that nature, that is going to be personalized based off your goals and objectives and when you want to retire, things of that nature. And so you definitely want to sit down with someone on an individual basis to get personalized counsel. The same way I wouldn't put on Gilberto's suit back there because it doesn't fit me. It's personalized for his body. Your financial plan needs to be in that same manner, right? It needs to be tailor-made for you and your family. On top of those 401k benefits, this is probably one of the biggest, I don't want to say issue, it hurts me to see it. I'll just say that. I work with people that are saving for retirement. I work with people that are about to retire, and I work with folks that are already in retirement. I get this all the time. Isaac, I got about $1 million in my 401k. I want to live off $30,000 a year for 30 years. I'm good, right? Math makes sense. About 900 grand, right? Mm-hmm. So when they say, well, Isaac, I got $1 million in my 401k, you know what my first question is? How much of that is yours?
Have you paid taxes?
Right?
Have you paid the fees?
How much of that is yours? I said, what do you mean? Government gonna get their cut. They are very smart. They're gonna wait till it grows to that big pot of money, and once you need it, oh yeah, you ain't been taxed on that yet, buddy. Yep. Let's get our dollars. So that $1 million that he was projecting to live a 30-year lifestyle off of, and it's not until he starts taking those dollars he realizes it's not enough. Yep. Now he's 72 years old and he's a greeter at Walmart because he outlived his money. I see it all the time and it breaks my heart because our people specifically, we rely too much on the government to take care of any shortfalls that we have. Mm-hmm. Now let's remove that context. The world we live in the information when it pertains to health, we are living longer, right? Quick history lesson. When Social Security was created, it was based off the life expectancy at the time, right? That bucket of money was only supposed to last 2 to 3 years. Yep. Then we started living an extra 10, an extra 15, an extra 20, an extra 30, and they never adjusted the rules to the bucket. That's why they are pushing the age out when you're able to tap into it from 60, 65, 72. By the time we get there, we may be
80, 90.
You may not even count on it no more. Literally, in the analysis that I put together for clients, I don't even count on Social Security. I just let that be icing on the cake. But with that being said, I want you guys to understand that 401k is a great product to participate in. But get counsel. Get counsel on this product. Get counsel on the way you're invested. Get counsel on the fees that's associated to the product. Get counsel on when you should pull distributions from it. I think this is something that folks probably are thinking or have heard. Hey, I'm about to buy a house. Should I take a loan out of my 401k? Y'all heard something like that before? You have?
Yep.
So what has been the dialogue around that particular type of conversation?
I need the money for my down payment, so I need to get this money
That's right.
out of my retirement plan.
That's right. Pay yourself back later.
But nobody ever pays themselves back later.
Right. Exactly. Those 3 words, I couldn't have said it any better. Don't do it. Right? If you haven't created a habit to save enough systematically on a month-to-month basis to take care of that down payment, you're not ready for the house. Why tap into something that's supposed to be tapped into 20 years from now? You just disrupted the ability to be able to compound
set
more
yourself
dollars
back.
over time. Right? The 8th wonder of the world is what?
Compound interest.
Think about this. Let's say if I was standing on the top of a little snow mountain. I ain't never been snowboarding before. Got a little snowball, and I started rolling it down. Let's say it gets 100 yards down, the snowball got huge. This is what people are doing when they take loans against their 401k. They run down the hill, grab some of that snow and say, I'll be back. And run and go take care of whatever down payment they have. And guess what happened to the snowball? It got smaller. And you got to come back with a bigger snowball to just recuperate what you've lost thus far because of time. And so people don't see that. So whenever they take loans out for their loan against their 401k, that may be a $185,000 difference 20 years from now. You just never know. So I'm not a fan of it. As you can tell, Kanye ran over. I'm gonna transition on. Pros and cons of employer benefits, especially with 401k. Pros, it is something that is offered for free. You're able to get, again, if they're matching 5%, that is 5% of money that is not yours. I wouldn't say it's a con. It's something to be aware of. It's just a tax distribution, right? It's very, very easy to accumulate wealth. It's very difficult to maintain it. But what I'm seeing now, the distribution portion of wealth and retirement is it's a game. You got to have a game plan for it, right? There are rules and characteristics assigned to the products that you have. Question for the audience. You have a 401k. When can you take distributions out? At what age?
After 59 and a half.
59 and a half. All right, what is the age if you don't take all of your dollars out that you're going to get penalized at 50%?
70 and a half.
RMD, required minimum distribution. Were you aware of that?
Most people don't know that.
If you don't pull all your money out.
If you don't take your money out, they're going to start penalizing you for doing it.
So, again, the government is smart. Think about it. If you, 70 and a half, think about this. How does the money get into your account for your 401k? Do you hit a button every time you get paid? What happens? Goes in automatically, right? 75, 80% of those in the U.S. today, that's a majority of their assets. So since it goes in automatically and you're not taxed on it, and by the time you want to touch it, let's say you're 59 and a half on a distribution, you do get taxed on it. What the government realized, they said, you know what? People are leaving dollars in their 401k and they're passing it on to their children. We ain't taxed that yet. How can we tax it? Let's make them take it all out by 70 and a half. And if they don't take it out by 70 and a half, we have a calculation. It's called a required minimum distribution. They put that calculation in, and if you don't take that amount out, at least penalize 50%. That's your money on top of tax.
Yep.
Yeah, make me want to chest bump some folks, right? You know. But again, if you don't know the rules to the game, So essentially, I just call this sharing the memo. All right, next one. Ooh, woo, debt from education. That is a very emotional topic, right? I wish there was a secret sauce. I really do. Y'all know I'm gonna be straight up with you. It is what it is. You know, it's debt from education. Now, any debt that we look at, we always want to tackle the one with the highest interest rate. Right? So if you have something that's 15%, 12%, 10%, whatever that highest interest rate, that's what we're going to tackle first. But there's no innovative way to eliminate debt. There may be a strategic way to create an asset to leverage to eliminate debt, but you know that's a one-on-one conversation. So I won't even get into the tidbits of that. Life insurance.
Question.
Yes, ma'am.
So when it comes to determining whether you want to save, pay down debt, like how should we be aligning our financial goals with paying off debt and